With that breaking news, the UK rolling out the first doses of a coronavirus vaccine to British citizens less than a week after becoming the first Western nation to approve a COVID-19 vaccine. There's 90-year-old Margaret Keenan getting a round of applause from healthcare workers after she got the vaccine. And that same vaccine could be authorized here in the U.S. by the end of the week. Foreign correspondent James Longman is in London with the latest.
Smiling behind the mask, 90-year-old grandmother Margaret Keenan is this morning the first person in the world to receive the Pfizer and BioNTech vaccine.
I'm feeling good. You look well. I was a little bit nervous, but now it's going away.
She turns 91 next week and says it was the best early birthday present.
I'm looking forward to Christmas. I didn't think I'd be getting home so soon from hospital, so I'm spending Christmas with the small four of my family members, and then we'll see what happens in the new year.
Britain is the first nation to approve it, with a rollout at 70 hospitals across the country.
Well, I would just say to all those who are scared, don't be. And you've seen Lynn take it, you've seen Paul, you've seen people take the vaccine this morning in large numbers. People are going to be taking it in the next few days.
And the second patient to get the shot was 81-year-old William Shakespeare. Yes, really. The second Shakespeare to make the history books. The first 800,000 doses are being given to those 80 years and older, healthcare workers and nursing home staff. The logistics complex. The drug needs to be kept at 94 degrees below zero, with each patient receiving 2 doses 3 weeks apart. It's a process the United States will soon start, with authorization hoped for this week. If all goes well, the US will see celebrations like these very soon.
And so Margaret will need a second dose in 3 weeks, and that means she won't be fully inoculated until about a week after that, around the 5th of January. So there is a fairly long road. Officials are urging caution despite the celebrations. But this does feel, Eva, like the beginning of the end of a very long COVID nightmare.
At least those first steps, James. And I'm curious, what's the mood like there in London? How are people feeling about this vaccine?
I think it's fairly jubilant. I mean, what they need, really, the government, is a great public messaging campaign. And who better than Margaret? You saw her there in her Christmas jumper. She said herself she wants people to go out and get the vaccine. She said she's felt kind of blessed to do it, and she wants others to follow suit. I don't know about you, but I found William Shakespeare to be an incredible example. And what a great story. You couldn't make that kind of thing up. And get this, he's actually from the part of Britain where William Shakespeare, the playwright, was from. I mean, I love that. But in all seriousness, you know, this is a very, very kind of serious issue to get people to want to take the vaccine. There's a lot of jubilation in Britain today, but they will move on to this public messaging campaign. We're going to see famous people probably take the vaccine publicly. We know when the Queen takes it, we will then find out. Royals are going to get in on the action. They're going to be publicly thanking health workers. We've seen the health minister crying on national television, talking about just how important this is. I heard one scientist say that there are understandable concerns about the vaccine, given that it's happened very quickly and there's not a lot of public knowledge about how vaccines are developed, but not legitimate concerns. And I think we're going to hear that message over and over again, that you just do need to take this vaccine if you want to be safe. So that's getting the message out there. But then there's the logistics involved in actually doing this. Remember, this vaccine needs to be kept minus 94 degrees. It's all very well getting it to big hospitals like this, 70 others around the country. But what about getting it to smaller residential care homes where there might be 12, 15 members of that care home who need it, moving them around? You know, Margaret's going to have to come back in 3 weeks. It's going to be even colder, back to that hospital to get her second shot. It's going to be in the middle of winter. And then we are now going to loosen some of our restrictions by the end of December for Christmas, which means there may be another surge of coronavirus in January, right in the middle of when we want to roll this vaccine out. And on top of all this, Eva, Brexit. I hate to mention it to you, but we have now left the European Union, but the kind of transition period ends on December 31st, which means that there may be an issue getting the physical vials over from Europe, where it's been developed in Belgium, into the United Kingdom. So yes, a lot of happiness today, but there's a long road ahead until everyone in this country finally gets their shot. Eva?
No question, that all sounds very, very complicated. James Longman for us there in London. Thank you for that report.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.